what is known commonly as counterfeits produced in legal or illegal facilities and not declared to the tax authorities. They also include illicit importation. This is smuggling of products produced in other jurisdictions and illegally transported to avoid applicable taxes. The impact of this trade is that it increases access, affordability, and consumption of tobacco products, undermines tax policies, leads to loss of revenue, promotes corruption, and undermines the legal and health regulations. Madam Speaker, the protocol had three broad provisions. One, prevention of illicit trade by securing the supply chain through registration and licensing of all manufacturers, requiring record keeping and reports from manufacturers on products produced and their destination. The implementation of tracking and tracing system, requiring tobacco manufacturers to undermine due diligence. Tracking and tracing, banning sale of tobacco products by internet, regulating free zones and international transit, and banning duty-free sales on tobacco products. The part 2 was on law enforcement, which looked at the protocol, establishes unlawful conduct. The protocol does not contain a catalog of criminal offenses. However, parties have discretion in determining which conduct is a criminal offense, including own, manufacture, sale, transport of tobacco products contrary to the provision of the protocol, for example, without a license. Manufacture, sale, transport of tobacco products without payment of duties, taxes, and other levies, or without bearing applicable fiscal stamp, and misdeclaring on official forms the description, quantity, or value of the tobacco products to evade payments of duties or taxes. Establishment of liability of legal persons, seizure payments, effective and dissuasive sanctions, special investigative techniques. And 3, international cooperation, exchange of enforcement information, including providing technical assistance and cooperation in scientific, technical, and technological matters, law enforcement cooperation, mutual.
Just, there's a problem with my, yeah,
Thank you. Let me go back to 3, international cooperation, exchange of enforcement information, including providing technical assistance and cooperation in scientific, technical, and technological matters, law enforcement cooperations, mutual administrative assistance, and mutual legal assistance and extradition. Protocol makes specific reference to enhanced cooperation between the Convention Secretariat and the UN Office on Drugs and Crime and the World Customs Organization and other bodies as appropriate. Madam Speaker, Kenya has actively participated in the development of the WHO Framework Convention of Tobacco Control, which is known as FCTC, as well as in implementation guidelines. This participation has led to Kenya by implementing the Framework Convention on Tobacco Control, hence becoming a global leader with various best practices that are a reference point of the regional and global levels. Article 15 of the Framework Convention on Tobacco Control deals with the combating illicit trade and hence required a protocol to facilitate its implementation across national and international borders. Kenya signed and ratified the FCTC on 24 June 2001. The Tobacco Control Act was passed in 2007 and was developed from the Framework Convention on Tobacco Control as a blueprint. Following the recent court judgment in favor of Tobacco Control Regulation 2014, the regulations for the implementation of the Act took effect on 24 August 2016. The protocol came into force in 2018 after 40 parties ratified it. Madam Speaker, I want to appreciate efforts taken by the Ministry of Health, including our very own Honorable Dr. James Ikal was there as the Director of Medical Services, as well as the Kenya Revenue Authority. The country has its own internal mechanism enacted the Tobacco Control Act, as well as KRA implementing stringent measures on movement of tobacco products. In fact, Kenya has received the WHO Director General Award for the exemplary efforts in the implementation of the protocol. The country is currently already fully implementing the protocol and is a reference point for the best practice and has indeed hosted numerous foreign delegations on benchmarking. Furthermore, Kenya has been the Bureau member for the Afro region in 2 consecutive terms, demonstrating the region's confidence in Kenya performance and leadership. As a country that is the manufacturing hub for tobacco products, exporting to more than 22 countries in Africa and beyond, Kenya is at a high risk of illicit trade in tobacco products. Kenya is surrounded by porous borders, making it prone to illicit trade. Moreover, Kenya has the highest tobacco tax rate in the region, further raising the vulnerability to illicit trade in tobacco products. Madam Speaker, it is based on this that I stand to move that the House adopts the report of the Departmental Committee on Health on ratification of the protocol to eliminate illicit trade in tobacco products. And I want to thank the members of the Health Committee for their continued support to the committee and their dedication to make sure that we pass the laws that are required to govern this country, especially on the health matters. And as I thank them, I would like to call upon Dr. Nikal to second. I move.
You move, Dr. Nyukal, for seconding.
Thank you, Madam Speaker. I rise to second the bill for the ratification of the protocol to eliminate illicit trade in tobacco products. Madam Speaker, there is need that as a country we sign this. The problem of tobacco is to a large extent a health problem. In fact, tobacco use and diseases associated with it actually cause the largest number of non-communicable diseases: heart diseases, vascular diseases in limbs, cancer. Some people think it's only cancer of the lungs, but actually any cancer anywhere can be associated with this: diabetes, chronic lung diseases, and, Madam Speaker, it even affects newborn children or children whose parents, whose mothers are smoking during pregnancy. They'll be born with this effect. And in Kenya, Madam Speaker, up to 23% of males use cigarettes, 4% in females, and even children between the ages of 13 to 19, up to nearly 10% are using cigarettes. And, Madam Speaker, cigarettes is actually the most commonly used product. And if you look at the deaths due to non-communicable diseases, 50% is associated with tobacco use. And illicit trade really needs to be controlled, Madam Speaker, because it increases access. And once you have access, if everybody can get it easily, the prices are low, and even children can actually get. And tobacco is addictive, so once children start to use it, it is very, very difficult to actually stop the use. And, Madam Speaker, Kenya, as the chair said, has really been in the leadership in the fight against tobacco use. From 2003, when the Framework Convention on Tobacco Use started, the process started in WHO, Kenya was an active part. Throughout, we had a membership in that group throughout. And by 2005, we actually had signed the Framework Convention on Tobacco Control when it came into being. And we followed closely to get the Tobacco Act passed in this parliament. It's one of the most tedious legal framework I did when we were in the ministry. And, Madam Speaker, the fight against the industry in this is always a huge fight. And unless we actually strengthen these instruments, is something that will go on. In 2007 to 2012, Kenya actually led the FCTC conference of parties, and we were very instrumental with all the parties, the Attorney Generals, the KRA, in getting it to being. And in 2013, we signed the treaty. So, Madam Speaker, why would we be the last, or why would we be late in ratifying it? And unfortunately, as Madam Speaker, as our chair said, our delegation went to a meeting and could not attend the meeting. They were in the precincts of the meeting, and yet we were the leading. In Africa, actually, we were the leading country. If you go to Brazzaville, the WHO regional office, Kenya will always be cited as the country to look at if you are looking at control of tobacco. We have an act, we have a board, and actually it's being funded. It's one of the few countries where there's an act and the board is being funded. With that, Madam Speaker, I support the motion. I second the motion for ratification.
Very well, very well. Honourable members, I propose the question, which is that this House adopts a report of the Departmental Committee on Health on the ratification of the protocol to eliminate illicit trade in tobacco products laid on the table of the House on Tuesday, November 13th, 2018, and pursuant to provisions of Section 8 of the Treaty Making and Ratification Act 2012. Approves the ratification of the protocol to eliminate illicit trade in tobacco products. Member for Kimilili is in the house. There's members who are leaving cards. Oh, you are there? No. Then, Tuwei is not also in the house. The members who are leaving their cards on the. Then I go to Oduol Odhiambo. Give her the mic. You can, honorable member, just move the next seat. You can use the mic.
Thank you, Madam Speaker, for the opportunity. And Madam Speaker, on the onset, I'd like to support the motion for the ratification of the protocol. Madam Speaker, when we consider the impact, indeed, as has been clearly indicated by the committee, of illicit trade, and when, Madam Speaker, we are looking at a context where what it is that is being conveyed in the illicit trade is tobacco, we can see from the outset that we are going not only to be dealing with material that in itself has potential to cause damage, but material that could be counterfeit, material that could be have been brought through avenues that are not correct, such as smuggling, material that would not have provided opportunity for Kenya and the public to get tax because there is tax evasion. And so, Madam Speaker, as I support the motion for the ratification of the protocol, I do it on the premise that it indeed is an opportunity that will ensure that we are able to block and reduce access that would be made to those who are vulnerable, because when we have illicit tobacco, we are going to find greater accessibility. We are going to find that it is cheap, and so children and a number of people who include expectant mothers, lactating mothers, and very many others that are unwell, because we know the impact that tobacco would have even to those who are experiencing challenges. So, Madam Speaker, as I support, I want to particularly commend that when we look at the report, we can see that there was indeed extremely good participation and consultation with key groups such as the civil society, the academia, and other key stakeholders, including Kenya Network of Cancer Organizations, and that the information that we put here does indeed confirm that it would be important that we ensure that we do not allow loopholes for the illicit trade on tobacco. So with this, Madam Speaker, I support the motion for ratification. Thank you.
You do support. The next on my request list is the Honorable Member for Suba North, Odhiambo Akoth Mili.
Thank you, Madam Speaker, for giving me the opportunity. Madam Speaker, at the onset, I do support and congratulate the committee for a good job. Madam Speaker, yet again, I want to also congratulate Honorable Sabina Chege, that has done an excellent job, even as the chair of that committee. And I want to repeat that women are doing excellent work in the House. And even now, as we are speaking, the person on the chair is also a female member. And Mr. Speaker, that is evidence that even when women the floor of the House. Madam Speaker, it is an excellent practice because involved in agreements that Kenya is undertaking out of the country, and it therefore precludes the things that the church was scared of, which is that we might be entering into agreements on things that Kenya is not very comfortable with, because once you ratify a treaty, it becomes the laws of Kenya. It becomes part of the laws of Kenya. But now that the parliament is part of the process, then we actually part of the legislative process, even in the ratification process. And it also gives the public a chance to participate through public participation. And I'm very happy that I've looked at all the organizations that have come before the committee. We have organizations dealing with children's issues. We have organizations dealing with cancer. And we have several organizations that are also giving warnings about the effect of tobacco on the lives of Kenyans. Madam Speaker, I want to also say that the protocol to eliminate trade in tobacco domesticated through the Tobacco Control Act. What is remaining for us as a country, therefore, is to ratify the protocol and to domesticate the protocol. But I want to thank the ministry that even in the process, as we are waiting to ratify the protocol, they've already started taking measures to ensure that they follow the provisions of the protocol. Madam Speaker, part of the issues that this protocol deals with is to control illicit trade and practices, including, for instance, counterfeit products or manufacturing of counterfeit products, tax evasion, smuggling. I'm sure one of the driving force for many countries is to make sure that revenue goes to the right place. But other than the revenue going to the right place, Madam Speaker, if you leave this illicit trade to continue, it makes accessibility or increases accessibility, affordability, and which results in consumption of tobacco going higher. And I want to agree with the different members, including Professor Odual, that has said that when consumption goes higher, it becomes very dangerous to pregnant and lactating mothers. It becomes very dangerous to children. And Madam Speaker, it also increases cancer. And cancer, and I'm very glad that today I also saw that there's, before our budget committee, I think it is Honorable Sabina who has brought something on radiographers, Madam Speaker, because we are having a big challenge in this country in terms of dealing with cancer. Madam Speaker, I'd only want to encourage the government that in the same process that we are moving with speed to ratify these protocols, that I would wish they would equally bring the protocol on small arms to control also small arms, because we are seeing a lot of misuse of.
Yeah, we had 5 minutes.
Warning, Madam Speaker.
They did not warn you.
Yes.
I agree with you. Give her 1 minute because you did not warn her.
Thank you, Madam Speaker, for indulging, because I was not one.
The machines actually, they had an issue, but you...
Oh, thank you, Madam Speaker. Finally, Madam Speaker, because you've been gracious to give me 1 minute, I would want to just encourage our male colleagues that they should understand that, because some of them are saying that when we are bringing the gender bill, that there will be no formula for nomination. Madam Speaker, the same way that we brought the Treaty Making and Ratification Act as an enabling legislation to give effect to a constitutional provision, we can bring an enabling legislation under Article 100 of the Constitution, and it is members who will decide how they will nominate whoever they want to Parliament. With those few remarks, Madam Speaker, I support.
The member for Ndiwa, you had your card, and give it the member for Ndiwa.
Thank you, Madam Speaker. Thank you so much, Madam Speaker. From the onset, I want to declare that I'm a member of the committee, and I want to thank our chair, Sabina Chege, who have been working so hard on this, and all members. Madam Speaker, we are in a global village, and Kenya is very much esteemed and ranked high when it comes to tobacco control. All of us can salute the late Matiba when he declared that smoking in buildings was outlawed. And even right now we have, even on the streets, designated areas where you can smoke. That means we have done so well when it comes to the tobacco control. And it is a pity for us to be sent out in meetings that we have not ratified these protocols. So as I support this motion, Madam Speaker, I really want to urge this House to adopt the report so that we can be on the right side when it comes to this prevention of, protocols used to outlaw the illicit trade of tobacco. It should be on record, Madam Speaker, that almost 11% of the illicit trade of tobacco, which is 460 billion cigarettes across the globe, is illicit through illicit trade. And that is denying countries over $40 billion. That's a lot of money. And what this does also, Madam Speaker, if we are serious on it, is that it is elusive to control structures which we have put as a nation to prevent this. As we all know, the burden of ill health on Kenyans, especially non-communicable diseases, is from this illicit trade. Because if the manufacturing and the distribution and the sale of these products are not on structured way of dealing with it, then even the underage will have access to buy cigarettes. As we know, we control the age of buying cigarettes as well. Also, what happens is that when the illicit trade is going on, we lose revenues, as have been said by other members. So taxes is being undermined here. And you will also remember that other countries, including EU, have assigned to this. These are big countries which have showed the way, and we cannot afford to be left behind, Madam Speaker. So I urge the House to really move fast, as we have done our part as committee to ratify these protocols for eliminating illicit trade. I thank you, Madam Speaker.
Edward, the member for Makueni, Romanzo Kitonga.
Thank you, Madam Speaker, for giving me an opportunity to participate and to support this very important motion on ratification of the protocol to eliminate illicit trade in tobacco products. Madam Speaker, Kenya is leading in legislation dealing with tobacco, and many other parts of the world have legislated on tobacco, and there are regulations and the practices such as advertisements on the dangers of tobacco. Because of nicotine, tobacco is one of the most dangerous products used in the world, and especially when used by young children. It affects lungs and has a lot of consequences. In fact, in some cases, cancer has developed, according to research, originated from people who take tobacco. The worst of it is when it is illicit trade. And in our circumstances, how illicit trade takes place, it is through the companies which are not the ones authorized to transact and to process tobacco in the right way, such that the cigarettes have no filters. Some of them are, fake products. And even a few Kenyans or people harvest tobacco raw and they process it illegally and even use it either for chewing or for smoking. Even illicit cigarettes at times, they just smashed up leaves of tobacco and they use a paper, like a newspaper to roll it and smoke it. Madam Speaker, it has such devastating health effects, such that it's not, since it is not processed and purified. And even worse is the loss of revenue, because that person who ordinarily would have smoked a cigarette which has been bought and the taxes have been paid. The government now loses revenue when you process it directly and consume it directly as an individual. In America, they advertise very well, and according to the protocols of the Americas, they advertise very well the dangers of snuff taking or even tobacco chewing. And it's clearly written on that particular product that you know, you are likely to get throat cancer or mouth cancer. And you know, with regulations like that, the person consuming that product assumes the danger, having known very well what's likely to happen to their health. And therefore, the regulation is very important. Purification of these products is very important. Some of the cigarettes have something which filter out some of the bad things like the nicotine and some of the carbons are able to be filtered out. And other cigarettes also have, they have added, you know, they have added scents which make the cigarette smell very well or very attractive when somebody, so there are regulations as to how do you brand or blend. You make sure a cigarette is branded in a certain way, you make sure notices are given in a certain way, and then when you blend it with other products, then there are also regulations to that effect. And this is what is captured in the protocol, such that countries have a common system of dealing with this particular product, which is very addictive. And actually, children are not supposed to smoke, you know, when they are underage and or sold to cigarettes. So these are the things we want regulators so that the health of our people, of the young people, is taken care of, such that by the time one assumes the danger of smoking, knows very well what they are doing, what it's going to do to their health, it affects reproductive systems, and they are likely to be very miserable in their marriages. Therefore, this protocol is very important, and I do support and encourage you know, many Kenyans not to smoke and to read the signs and to the warnings. I thank you, Madam Speaker.
Very well. The member for Ainemoy, Honorable Maritime Sylvanus.
Thank you, Madam Speaker. I rise to support the motion, and in doing so, I want to congratulate the L Committee under the leadership of Honorable Sabina Chege for the work well done. Madam Speaker, by ratifying the protocol, we are assisting to kill the growing production of, or rather the growing black market that have led to production of counterfeit cigarettes. Madam Speaker, in so doing, we are also ensuring that we prevent the lives of young ones. We also not only coming up with preventive tools for production of cigarettes, but at least again, we will be having a proper legislation and to avoid selling cigarettes to underage Kenyans. Madam Speaker, by ratifying the protocol, we will also be complying with WHO regulations that we ensure a safe working environment. Therefore, I rise to support. Thank you.
Very well. The member for Turkana County, Honorable Emani Korakai.
Thank you, Honorable Speaker, for giving me this chance. I first want to appreciate the committee led by the ABO Chair, and I want to echo the words of Honorable Millie on the capacity of women when it comes to legislation. Honorable Speaker, this protocol is the first to World Health Organization Framework Convention on Tobacco Control, FCTC, which is a treaty in its own, an international treaty rather, in its own right, with an objective to eliminate all forms of illicit trade according to Article 15 of the WHO FCTC. Honorable Speaker, I see three critical issues. One is health, which has already been spoken to. In talking of cancers, talk of lung cancer, larynx, nose, throat, chronic bronchitis, asthma, emphysema, and such. Honorable Speaker, the nicotine that is produced in tobacco is what causes addiction. And more often than not, we think it's the smokers who are at danger. We are also at danger sometimes when we sit near people who smoke, because we actually breathe in more nicotine than the smokers themselves. Honorable Speaker, the other critical issue is security, because some of the proceeds from this illicit trade actually finances criminal activities. So we have all reasons really to support the ratification of this protocol. And finally, tax evasion definitely is an issue of revenue loss for our country. It's an issue, it's actually the protocol is very timely. It comes at a time when Kenya is fighting corruption and theft, and this should be a driving force on this. Honorable Speaker, illicit trade on tobacco products actually increases accessibility and affordability of tobacco products. Anybody can access them, including children. And so this protocol really will bring in good controls. And finally, Honorable Speaker, Kenya needs to be at par with other progressive parties that have ratified this protocol, so that together, Honorable Speaker, we can fight this illicit trade even across borders. With those few remarks, I wish to support.
You wish to support. The member for Vihiga County, Honorable Adagala Kahai.
Yeah, thank you, Madam Speaker, for giving me this chance to add my voice on the motion on ratification of protocol to eliminate illicit trade in tobacco products. I would want to say first to congratulate the chair of the committee headed by Sabina Chege, and I'll echo the same sentiments. Millie Odhiambo has just said here that women, when given opportunity, they do excellent work. I therefore want to congratulate Honorable Sabina for the good work you've done concerning this motion. And this comes at a time like this when we are fighting diseases like cancer. Like me in particular, I lost an uncle on tobacco-related diseases. And it has actually come at the right time that this treaty to be, that approved the 2012 treaty that approved the elimination of illicit trade in tobacco. These tobacco things, like the products, actually, it may be a loss to the farmers or whatever, the traders, but sometimes if it's misused, the taking of tobacco brings a lot of damage to the lungs of our people, to the inner parts of the body. And also you find like some people smoking in public places. We thank God here they are put designated places for smoking. You find the people smoking all over, and it will affect even those ones who are not smoking. This treaty is good. It is going to do good to our people, because when you look at most of the people who smoke, some make the cigarettes make people to be, some of them to be not active. Like the male side, you find they're having problems somewhere. I've had a case where a woman came to me complaining the libido of the husband has gone low because of the outcome of tobacco smoking. So, Madam Speaker, I would support this with the highest possible program. This program, I would support it so much in that it has brought problems to the families. Therefore, I'm supporting this ratification of tobacco, this protocol to eliminate illicit trade in tobacco products, because this will also make sure that we don't have counterfeits coming to our country through our borders. Maybe these corrupt traders bringing in some of the funny or those poor products from other countries. So far, Madam Speaker, I'm supporting this motion, and it should and the adoption of this motion. Thank you, Madam Speaker.
Very well, very well. Honorable members, there being no another request to speak to the report, I therefore call upon the mover to reply.
Thank you, Madam Speaker. On the onset, as a reply, I want to thank the members of my committee for the commitment they have shown, Madam Speaker. We have had several amendments and also bills and this protocol and other activities, even visiting the facilities that are under the national government. You have always had a quorum, Madam Speaker, and they have shown a lot of commitment, and I want to thank you for the support they have given me as a chair, and that is why this work is, we're able to submit to the House. Madam Speaker, I'll also urge the leadership of the House. You have several reports, one for the Kenyatta University, another one for an investigation we are doing about the one person who was charged a lot of money. And we have submitted this to the House. We are hoping then before we go on recess that we'll be able to address ourselves and address the House and move those motions, Madam Speaker, so that then our work will be able to be fruitful. As I also thank the members, Madam Speaker, I want to thank you for your patience, for giving us an opportunity to express what is in this protocol and the issues about tobacco and the people who are the tobacco users. Majority of the members have expressed themselves, the non-communicable diseases, the issues about the health matters, the issues about performance and breaking some marriages, Madam Speaker. And I'm sure several of our Kenyans have seen the photos, and I would like to urge Kenyans to take it seriously. When they see the photos at the cover of that tobacco product, let them not assume that it's just there to threaten them. It's the reality, and that is what is happening. So, Madam Speaker, I beg to reply, and I request we defer the putting of the question as per the Standing Order 53.3 to the following day, Madam Speaker. Thank you. I move.
You reply?
Yes, I reply, Madam Speaker.
Very well. And members having the report debated and replied, and again, the same member, Honorable Sabina Chege, is raising on Standing Order number 53, 3 on deferring the putting of the question. Members, I do order that the question to the ratification of the protocol to eliminate illicit trade in tobacco products be moved to tomorrow, as it will appear in the order paper. Next one. Next order, yes.
Order number 14, the Capital Markets Amendment Bill, National Assembly Bill number 19 of 2018. Second reading.
Yes, the Chairperson, Departmental Committee on Finance and National Planning. I can't see him in the House, of course. I'm sure it was anticipation of the long debate. Then I defer the order number 14. Next order.
Order number 15, the Insurance Amendment Bill, National Assembly Bill number 21 of 2018, second reading.
Chairperson, Departmental Committee on Finance and National Planning. I see same case. I order that number 15 be deferred. Next order.
Order number 16, the Circle Societies Amendment Bill, National Assembly Bill number 18 of 2018.
I see same
Second
case.
reading.
Same case, that is the Chairperson of Finance and National Planning. Honourable members, I do order that order number 16 be deferred. Next order.
Order number 17, the Government Contracts Bill, National Assembly Bill number 9 of 2018, second reading.
The leader of majority, I cannot see him. I'm sure this was because of anticipation of the other three orders. So, honourable members, I do order that order number 17 be stood on. Next order.
Order number 18, the Assumption of Office of the County Governor Bill, Senate Bill number 1 of 2018, second reading.
The Chairperson, Departmental Committee on Administration, National Security. I'm sure due to the same reasons, then is not in the House. So I do order that order number 18 be deferred. Next order.
Order number 19, the National Flag, Emblems and Names Amendment Bill, Senate Bill number 8 of 2017, second reading.
Calling upon the chairperson, Departmental Committee on Administration and National Security again on order number 19. And now that is not in the House, and I'm sure members it is due to the deferring of the other orders. Then I do order that order number 19 in your order paper be deferred. Then, honorable members, there being no another business in our order paper today, the House, order members, and the time being 18:57 p.m., the House stands adjourned till the Wednesday, tomorrow, 28th November 2018, at 9:30 a.m. I thank you all.